We have the Legislative Health Chair, Senator Therese Terlaje. Good morning, Senator.
Buenas. Good morning, Chris, Sabrina, and Jason. Good morning.
Right on. I guess, and we'll just jump right in this conversation, and we'll get to the oversight hearing, of course, because it's huge. The conversation we're having this morning about the executive order that came out last night mandating more businesses and to reopen and easing of more restrictions. Coming at a time when we just had public health on an hour ago. The state epidemiologist said that the cases are still high, that we're doing worse than Hawaii, and that, well, basically when we asked her, well, should we be able to open now with what's going on? She said, oh, it's the governor's call. In a public health emergency, I mean, it is the gov's call, but we just want to get your take on all of these developments, Senator.
Well, thanks, Chris. Yeah, that's pretty much the same that we heard yesterday at our public hearing. It's that they are still very concerned, of course, with the number of cases and the hospital's capacity. Yet, but they told us it's the governor's call. And so I was a little surprised to hear that. I was expecting public health to have a more, the more influence of, in this public health emergency. That's the way our statute is written. Although I understand the governor has the authority to write the executive orders and to order things open or close. So, but, I think it's a balancing act. And so there were some good things, of course, that public health has definitely improved its tracing capacity. And I'm very happy for that. That was it's always been critical. So even since May, we've been asking them, is your tracing capacity capable of, tracking if we open up? That was when we were contemplating opening up back then. And they said yes, but then they became overwhelmed. And so, we were very confused. How could that happen? And so now they're assuring us that they are able to trace, they're able to contact people, first of all, within 30 minutes of a test. They are able to inform close contacts, family, the whole household within 5 to 8 hours, make sure that they get advice as to quarantine. They're able to, advise those positives that they need to get into isolation. So all of this within 5 to 8 hours now. And if you remember the last hearing, we were talking about days, and it was even taking in some cases longer than that because of they were overwhelmed. So very glad to hear this. They've increased the number of people that are working on this. So the more we have to trace and test, the more I think we will be able to open. That's the key. That's what we keep saying for our tourism industry. We're going to allow visitors if we're able to test them and we're able to trace them. So this increased capacity is great. And they've got some backup capacity also. And they're still building it. So they're using federal money to continue to hire more people and to build that capacity. The things that were not as satisfactory were, as I think you discussed with public health this morning, and that is, we're still hearing that, the biggest part of the spread of the virus is a community. They call it community spread, community contact, and we can't get the data as to what they mean by community contact. It includes, every activity, and so we've asked them for months to detail that activity. And I feel like if we could detail that activity or what is creating the risk, then we would be able to convince the public as to, to respond appropriately. And all of this is a very delicate balance in trust, I think, so we've asked the public to do things based on, our recommendation. Please sign up for this app. If we can get 60% to sign up, it's going to help our community to open up. But we haven't been able to get 60% yet. And so that's disappointing, and it doesn't make us confident, So we need all of these things to work together. We need, people to sign up for the app. We need details on this community contact. They said yesterday at the hearing that it would not be ready for maybe a month. And I just cannot understand that part because I'm so confused as to how these decisions are being made if they do not have this data presented to the public, to the physicians advisory group, to anyone who's making the decisions. That's how I want the decisions to be made, is based on data.
So having said that,
and
do you know how these decisions are being made? Was it expressed last night how the decisions are being made? Did anybody say if we don't have
Well, they said
the data?
they said they attend. You heard that Dr. Ann. She attends the physicians advisory group. She gives them what she knows, and she says it's up to the governor. The governor makes the decision. So I think the physicians advisory group also says that they've made recommendations to the governor, and I know that we all want to open. Oh, we all want to open businesses. Of course, that's the goal, right? We want people to get back to work, especially we want them to get back to as normal a life as they can. But we all know we have to do this differently. We have to do it safely. And so that's why, even with opening, we have to have data. We just have to. We have to know that these decisions are being made logically, and that we can use the data to convince everyone. It's hard to convince people to stay away from the beach if we're saying the spread occurred at a bar. You know what I mean? So that's why I want to be able to tell people it's been proven. The funerals, even with the rules, if that was the case, that even with the rules, those rules were not sufficient to protect people at funerals spreading this virus. And so the other from the Division of Environmental, they're working very hard. They are the ones doing the guidelines for these businesses. The businesses have been great. They've been writing their own guidelines in a lot of cases. The GHRA has helped write guidelines. The Women's Chamber of Commerce has helped write guidelines for businesses so that prevent these public health and get their businesses approved for opening. But the Division of Environmental Health, who's charged to enforce these new guidelines, has not increased its staff yet. So we urged Linda Dorsey, when she was the director, to apply for additional money to get additional inspectors at the division. And she did apply, and finally, before last hearing, that was approved. But today we found out they haven't received the money. They haven't hired in that area yet. They've got that money, the $3 million of extra money that they will be getting, and they've got the federal money because of COVID that they're supposed to be using to shore up this capacity. But the hiring seems to be taking a while.
Senator, let's just put on our GMH hat just really quick, and the idea seems to be that we're gonna do these gradual reopenings. And we're going to allow for more easing of restrictions because the hospital's at a place where it's acceptable now, right? Like the number of people with the hospital, because the hospitalizations was a key part of us staying in PCOR 1 or us getting out of PCOR 1. And so, yeah, they've kind of gone down, but I've been talking with Lillian, part of that's because a lot of people are dying, like one person's dying every day, right? So do you feel that GMH is in a good enough position, like stabilized, right, so we can move forward with the easing of restrictions and reopening of things?
I've heard your interviews with. It certainly does not sound like it. Of course, it's GMH Public Health. They are our heroes because no matter what comes their way, they're going to do it. They're going to do it. They're going to persevere, and they're going to take care of it. And they've taken this very seriously, and so I really want to commend them for this. These are really dedicated employees. We hear it from her. No, she's begging us to stay home. Do not spread this anymore because you're putting everybody at risk, and because of their capacity. So I'm not sure that the hospital capacity significantly improved. I think it may, and you see that, Chris, it changes on it, so it's a little too early to tell that it's changed enough where we can be comfortable. I'm not comfortable.
Yeah, I'm not comfortable,
So
but
I
only
think
only because mostly we have public health on, and public health is pretty much doom and gloom. And then we have GMH on, and GMH is pretty much like, hey, stay home, everybody. Don't go anywhere. But then we have the governor's like, yeah, we'll go to the beach, go gather, congregate. And so it's just a little confusing with the mixed messaging, especially when it's kind of life or death, connection.
Well, I'm sorry, these public health representatives on your show, Reggie, and that you have GMH on regularly, because I believe that hearing from them directly more often helps the public. That's the only place they're going to get that message right now, right? That they're going to hear directly that, no, we are in high risk still, and we are very concerned. And when you hear the hospital director saying we are very, very concerned, causes all of us to be concerned. So I think that's effective, and I want to thank you for continuing to do that. That's what helps people, change their behavior. I think they need to hear that.
Is there anything
that's their.
Is there anything the legislature can do to have Adelup or their chief of staff, whoever, to come down, just kind of explain the decisions that are being made and the provide the data in which the decisions are being made? I want to say early on there were like these informational briefings and things like that. Is that something that the legislature can do today, so we kind of have a better idea about these decisions and these executive orders that are coming down? I mean, if we're confused, I can imagine maybe the legislature might be a little bit, or, some of them might be getting the inside scoop before everybody else.
Oh, I don't think so. For example, we were not aware of this new executive order when we had the public hearing yesterday. Otherwise, of course, I would have asked public health more about it. Like, what part of this do you support or not support, or, have concerns about? Mm-hmm. And what data supports this? I would have asked them that straight out, and I've asked them that on many occasions. What data supports this or that? This opening and that not opening, but they continue to tell me they're unable to share the data. And at first they thought they were not allowed, but I think now that they've got guidance from the Attorney General, they know they're allowed if it's related to tracing efforts and if it will help them with their investigation. And they've promised since our last hearing on September 8th, I think it was, that they were going to give us this more detailed information, especially, for example, what constitutes community contact, but they're not ready. Now they're saying a month, and I that's just too long. So anyways, we do.
So how many more people have to die before we can get the data, basically?
Yeah. So a couple times, I asked Dr. Cabrera to brief me, and then I invited all the senators to join us to be briefed by him. But they want this information to be private, and it's very difficult for us to go out there and say, this is what we know, and this is why you should do this if it's designated, private. So we've of course asked them and encouraged them, and I've asked to be part of the physicians advisory group. So at least as the health chair, I could understand all the different concerns that are on the table, and then maybe, I could do what I could to support those concerns, or to convince people that, the logic behind all of it. And but I think, we're
what was the response?
Yeah, what did they say? What did they say when you asked, Senator? I'm curious. Who told you no?
Oh, they said no.
Who?
They said no. We want to be able to discuss this privately without any. That's what they said.
Without any pesky senators.
Yes, I guess. But the speaker has set up weekly meetings with the surgeon cell. So, there's different groups here. We've got the surgeon cell, we've got the physicians advisory group, we've got public health, and you've got the economic group, right, that advises the governor. So the speaker has set up meetings with the surgeon cell.
Is that open to you as the healthcare oversight?
She's
so you're able to.
She's invited all of us. Yeah. So this is with Dr. Mike Cruz. But pretty much, we're hearing we're seeing, the charts that they show during the press conferences, and we are allowed to ask some questions. So those are helpful, but
So are you saying he's not giving the data?
the information is not in advance like you think. Like it's just pretty much same time as what we're doing with what the governor's been doing for press conferences. So
Right.
I guess things change, quite often. I would prefer to see these type of briefings public as much as possible and as often as possible. I just think the people in Guam, they still, trust the doctors, and they would like to hear from them. They want to hear the why. It's we need to be united in this. I think you all agree, and I agree. We need to be united, and so if we can all understand the why at the same time, we can act together. It has to be at the same time.
Yeah, you lost me at United.
Yeah.
Well,
No,
I'm just saying
I
we
know.
want our community to act together. If you look at the successful countries, I think that's what they cite. They cite that everybody is willing and very willing, and they trust the government, and they're willing to do what the government has asked them to do. That is key.
Yeah.
We want our people to trust and do what the government is asking them to do. If that's going to help us get out of this faster, then that's what we need to build that, and we need them to do that.
Yeah. It's
I,
just,
for one, I'm willing to do whatever I can to convince people to stay home. I'm very concerned about the death rate. I've known so many of these people that have passed away, and it's like we said in the very beginning, even one is too many, right? And what we're seeing now, very young people. I mean, it's heartbreaking, but that's an understatement, right? It's kind of like I'm willing to do anything to protect these people, and so sometimes it reminds me of these court cases. We set the court system up so we've got the prosecutors and the defense lawyers, and we pay for defense lawyers if they can't, and we want the system to argue with to be balanced so that both sides get to present this information, and then the decision maker is going to make a decision. And so sometimes I see that to be very similar here. Businesses who want to open, arguing to open businesses that they're very safe and they're going to comply with guidelines. And I think they have done an excellent job for the most part in complying with the guidelines. Mm-hmm. The ones that haven't, I'd like to learn the details of those and see the plan for that, without an increase in investigators at the Division of Environmental Health or the inspectors. Mm-hmm. I worry a little bit about that.
And we know that the Division of Environmental Health are out there doing these inspections because we get them. We get that right. They're doing their COVID-19 inspections and they're doing their sanitary inspections. And yes. It's not just like 5, it's like 40, 50 places that they're going out and inspecting. So kudos to Tom and his team.
They work really hard. Tom has an excellent team, and they work very hard. But I just think if we're talking about opening, then, and everybody's operating under new guidelines. Yeah. Everyone. Yeah. So,
and it's all the more reason, right, that everybody, if you're going to go out, you have to don't let your guard down because it has this trickling effect.
Yes. That's why the director did apply for additional money from the governor from that 117 million so that she could hire more inspectors. Right. That was part of the plan.
Well, Senator, closing thoughts here?
I just want all this in place.
Right.
Yeah.
Oh, well, I want to, Public Health's doing they're working very hard. They still are. They're increasing their capacity. I'm very happy for that. We're pushing them to get the data out. I think we need to know what data is being presented to the Physicians Advisory Group, what data is being presented to the governor. I think that's going to help us, understand the logic and convince more people that it makes sense. Mm-hmm. It's simple as that. It's if we all I've always said this about actually for everything, not just the pandemic, but the more the people know, the more we're going to be on the same page, and the more, we don't have to fight about it. It's very clear. We understand. And so that's the goal for me. That's what I'm hoping we're going to do with public health, is get the data out. I hope I'm going to continue to call them, and if we can send some help, do whatever we can to get that data out sooner. They've got help from Department of Labor, entry clerks, they said, entering some of this data. So hopefully they can get it out sooner than a month. We want the decisions to be based on that. So I just can't see how we're going to wait 1 month for it.
Right. Yeah.
And but otherwise, yeah, I'm still very concerned. I think the community should still act concerned. No matter what opens, they should act concerned. They should take care of themselves, their families, by, doing what they've recommended: the mask, the social distancing, and we've got to be strict about it. We've got to develop a new culture of that being, ways to show our love despite, social distancing, and our friendships despite social distancing. I'll tell you, it's hard. We got a campaign going on, and I see your next guest here on the Zoom. We were down in Maritza on the weekend, and it's new, and we wave from far away. We just make symbols and different things because we want to keep everybody safe. So I just want to continue to encourage that.
There you go. Yeah, a whole lot less handshaking going on in this campaign. That's for sure, if any.
Oh,
No, but people still don't.
Out of love, and I hope everybody understands. Yes, that is an act of love, is to just keep your distance, because this is the thing that I think is a little confusing too. They say, people with symptoms should not go to work. However, they continue to tell us those without symptoms are the ones that they're spreading this actively. They know that.
Yeah.
And so that's the very difficult part of this decision making, that's very difficult. I think even for the doctors, it's like, we know there are asymptomatic people who are spreading this disease, and
Right.
how do we control that?
And they won't do it. I mean, a temperature check at the entrance to anywhere won't detect an asymptomatic person at all.
Right.
Yeah.
It doesn't at all.
Yeah.
Nothing does.
Right.
Yeah.
Yeah. Thank you, Senator.
Thank you. Thank you.
you.
And have a great day.
You too. Be
Stay
safe.
safe.
Wash your hands.
You too.
Okay.
I will.
Okay. Good morning. 8:50. We're taking a really quick break, and we're coming back with candidates here for Congress, Republican Will Castro and Democrat Robert Underwood on the link.